Why are TB sputum culture tests so costly? Imagine trying to catch a tiny, slow-growing bacteria that can hide deep inside the lungs. That's what a tuberculosis sputum culture test aims to do. It's a detailed process that takes time, resources, and expertise, which all add up to the cost. First, growing the bacteria from a patient's sputum sample isn't quick. Mycobacterium tuberculosis grows very slowly, often taking several weeks to show results. To do this safely, laboratories need special facilities called Biosafety Level 3 labs, which are designed to handle infectious samples without risking contamination or infection. These labs requiring advanced equipment and highly trained staff, both of which are expensive to maintain. Beyond just growing the bacteria, the process involves multiple steps. Doctors usually collect several sputum samples from the patient over a few days to increase the chances of detecting the bacteria. Once the sample is in the lab, technicians use specialized media that support the slow growth of tuberculosis bacteria. After incubation, they perform additional tests, like biochemical assays or molecular tests, to confirm the bacteria's identity. These confirmatory tests are essential because they help distinguish tuberculosis from other bacteria, but they also add to the overall cost. Laboratory overheads also play a big role. Maintaining the equipment, ensuring quality control, and training staff all requiring ongoing expenses. In some settings, especially where testing volumes are low, these costs are spread over fewer tests, making each test more expensive. Sometimes, repeated testing is needed to confirm the diagnosis or to monitor how well the patient is responding to treatment, which further increases costs. Where the test is performed also influences the price. In high-resource countries with advanced healthcare systems, costs tend to be higher because of labor and infrastructure expenses. In lower-resource areas, costs might be lower but still significant relative to local income levels. The price of a sputum culture test can range from a few dollars to over $60 depending on the region and the complexity of the testing process. When combined with other tests like smear microscopy, the total can be between $10 and $40. Additional identification tests can add another few dollars up to over $30 if the bacteria are confirmed. Without insurance or government subsidies, patients might pay anywhere from $25 to $175 for these tests. This high cost reflects the technical challenges involved in accurately diagnosing tuberculosis. It's important to remember that despite the expense, sputum culture remains one of the most reliable ways to detect active tuberculosis infection. It helps doctors decide the best treatment plan and prevents the spread of this serious disease. Always consult healthcare professionals for personalized advice and remember that investing in accurate testing is crucial for effective disease control and public health.